like to say that this kind of campaign that we're running is serious, and we're here to defend this hospital. And we're especially here to make sure that Mr Kershaw doesn't do to the Royal Sussex and to the Princess Royal and Haverseat what he tried to do to Lewisham General Hospital. And I would like to thank all the people who have come down from Save Lewisham A&E for coming. If there's anybody in this crowd that knows how Mr Kershaw operates, these people do. And their knowledge and experience of Kershaw will be invaluable in the months ahead. So,
brilliant turnout, thank you very much. It is incredible for the second go. So, well done for coming out. Bring your friends, your family, bring anyone. Grab them along the street next time, because there will be a next time.
You see me, John?
Mr Kershaw, when thousands get on the streets in Brighton on a Saturday, you need to be very worried indeed. I can tell you, as someone who has a national role in the GMB, NHS supporter numbers are growing day by day. Well, our simple message to Mr Kershaw today is we didn't let it happen in Lewisham, and we're not going to let it happen in Brighton. If we win this fight, and we must win the fight, we can stop the carpetbagger in his trap. So friends, let's redouble our efforts. Let's tell our friends, let's tell our neighbours what's at stake, and let's organise, as we always say in the GMB, and let's send Mr Kershaw and many of the others on their way. Hands off our NHS. Thank you very much.
Save Sussex Hospital!
Save the NHS!
Save Sussex Hospital!
Save the NHS!
Save Lewisham Hospital!
And I passionately believe that everyone has the right to good health care, free at the point of use. And I want to be absolutely clear where I stand. I oppose privatisation of the National Health Service, and I'm going to do everything in my power to stop it from happening. We already know that our local hospital hearing services are going to Specsavers. Staff working in kidney services have been cut and the service has been privatised. Neuroscience and trauma services are under threat next year, and so are sexual health services. Privatisation of parts of our National Health Service crosses a red line for me. But privatisation is exactly what the Health and Social Care Act is designed for. This Tory Liberal Democrat coalition has unleashed a tidal wave of market forces into our NHS. The National Blood Service supply has been sold to a US private equity firm.
Typical.
NHS Direct, which led the world in remote healthcare assessment, advice and information, has been broken up into a patchwork of inconsistent localised services. Competition law has been introduced into the NHS by the Tory and Liberal Democrat coalition. £11 billion worth of services have already been privatised by this government. The Health and Social Care Act has wasted £3 billion on reorganisation, money that could have been spent on healthcare. And what are the result of these changes? 6,000 fewer nurses than we had in 2010. Accident and emergency times are rising, and we've got competition instead of collaboration. Please join me, the GMB and Sussex Defend the NHS in the campaign against the cuts and privatisation of our local NHS. Thank you.
Hospital!
Save the NHS!
Who's NHS?
Our NHS!
Whose hospitals?
Our hospitals!
Kershaw!
Thank you, it is really brilliant to see you here, and the kind of reaction reaction we were getting as we were walking through the city, I think just demonstrates how much people care about their NHS here in the city and will fight to defend it. Pay rises for hard-working NHS staff have already been frozen or limited. The RCN locally tell me that restructuring has meant both senior nursing posts and many specialist nursing posts have gone because they're too expensive. Audiology services, renal services and more are all under threat because of this nasty government's agenda to commercialise healthcare. And that's why we say it is obscene that £3 billion has been wasted on NHS reorganisation alone. We say that £3 billion should have been spent on caring for the sick, on reducing waiting times, on saving lives, on ensuring that workers are properly paid. This Tory-led coalition's intention has always been to dismantle the NHS as a public service. They want to shrink the state. You know, this austerity crisis isn't a crisis for them, it's a wonderful opportunity to do what they've always wanted to do, to roll back the state. They want to invite private health companies into a deliberately fragmented and complex NHS structure. And that's on top of the ongoing disaster that is the private finance initiative. Nobody in their right mind would take out a payday loan to buy a house. But that's effectively what's happening in the NHS, starting under the last Labour government and continuing today. The Department of Health and the Treasury should investigate the financial terms of PFI contracts to make these crippling terms available for public scrutiny and, when necessary and possible, to renegotiate those contracts. We must say no to PFI as well. The next general election is far off. Let's make that election about repealing the Health and Social Care Act, about ending the privatisation of the NHS that's happened under successive governments, about restoring the Secretaries of State's responsibility for the NHS. Because I'm not afraid to call for the NHS to be one that is true to its ideals and founding principles, that all health services in the UK, including dental care, eye care and prescriptions, should be free at the point of delivery for everyone. The Green Party believes in a publicly owned and publicly run NHS. The profit motive has no place in healthcare. We say again, no to cuts, no to privatisation and no to austerity. The government is now trying to change the law, as people have mentioned. We as a campaign are calling on Hunt to resign because we've got no confidence in him as a Secretary of State to look after our NHS. Our NHS is not safe in his hands. We're also going to petition and campaign against the Care Bill amendment, which seeks to make it possible for a Trust Special Administrator to close any hospital anywhere in the country that he sees fit. The thing that they couldn't do to Lewisham, they're now just trying to change the law. Our campaign in Lewisham continues because although we've won for now, we know that there are huge attacks and huge assaults across the whole NHS, and that they will come back again to try and get our hospital and our health services, and the threat of cuts and privatisation and PFI has not gone away. So our campaign continues, and we think a very important part of that campaign is solidarity actions like this, joining with others to support them and to receive support from them and to fight together to defend our NHS, because it is up against it. It is facing the most severe attacks since it was founded. And if we don't all fight together, and if we don't win, we will not have an NHS left. But what I think the message from Lewisham, the lesson from Lewisham is you can fight, you can organise, you can mobilise, you can fight and you can win. And that's what I think we hope people here in Brighton will do the same. Thank you.
There are some parts of our movement that think it's mistaken to go on the offensive against Mr. Kershaw. They say we shouldn't personalise the issues. They say we need to be reasonable. They say we need to compromise. They say we should be seen to do our bit. My response to such sentiments is simple. Matthew Kershaw was appointed and very handsomely remunerated to carry out Jeremy Hunt's dirty work, to impose cuts on our NHS with our money, cuts that are neither economically justified nor socially responsible. And as we all know, these cuts are in fact driven by a faith in the free market. The same free market that now gives us fuel bills so high that many of us will be unable to heat our homes this winter. These cuts are the NHS. We have to do it ourselves.
I'm here today to thank you on behalf of all GMB members of Brighton and Sussex University Hospital Trust. Our members salute you for showing the determination to stop Matthew the Axeman Kershaw from destroying our local hospital and its services. May I remind you, Mr Kershaw, that some months ago the GMB warned you of their opposition to your plans. The GMB remonstrated with you. The GMB exposed the unfairness of your strategy, and the GMB urged you to change direction. But you just ignored the democratic process and never listened to a word that was said. It is therefore obvious to all of us gathered here today that the lesson of your defeat at Lewisham Hospital has taught you nothing. Instead, you just endlessly push forward the agenda of delivering our hospital services into the hands of your Tory privateer chums. Well, Mr Kershaw, those days are coming to an end. Your vandalism must be stopped, and the GMB assure you it will be stopped. From now on, every move you make that pushes forward privatisation or outsourcing of our NHS hospital or its services will be met head-on with resistance from the GMB. No more will you wend your merry way, slashing and burning that which you have no right to destroy. You just don't get it, do you, Mr Kershaw? It's our hospital, and we consider it our little part of the greatest social achievement of the British people, the National Health